that we can fix everything and fix all the problems for people. We can't. The undeniable truth here is that this virus is a deadly enemy, and we will lose, and we are losing people who are vulnerable to the virus. That can't be controlled. That can't be fixed. Why? That's Mother Nature. That's a question that God can only answer. But control what you can. Do what you can. The challenge is to make sure that we don't lose anyone who could have been saved if our healthcare system was operating fully. Don't lose anyone who you could save. That is a legitimate, ambitious goal of government. And that we have done so far. That we have done so far. Have we saved everyone? No. But have we lost anyone because we didn't have a bed, or we didn't have a ventilator, or we didn't have healthcare staff? No. The people we lost are the people we couldn't save. Not for lack of trying, and not for lack of doing everything that we could do as a society, not only as a government and as a healthcare system. So to the extent we can find peace in that, it helps me. And we are still New York tough, and New York tough means tough, but tough in a New York sense also means compassionate. It means that we are unified. It means that we are loving, because if you're really tough, the really tough guys, they're tough enough to show love. And because we're smart. And that's how we're going to get through this. Questions?
It's drug trial of hydroxychloroquine and chlorine going.
We've allowed usage of the hydroxychloroquine with the zithromycin pack in hospitals at their discretion. The federal government is going to increase the supply to New York pharmacies. We had a 14-day limit on how much you could buy because so many people were trying to buy it. If the federal government increases the supply to New York, which they say they're going to do, then we could lift the 14-day limit. There are a lot of people who rely on this, who were relying on it, people with lupus, et cetera. The tests in the hospital, they won't say that they're too short a period of time to get a scientific report. You know, hospital administrators, doctors want to have a significant data set before they give a formal opinion. Anecdotally, you'll get suggestions that it has been effective, but we don't have any official data yet from a hospital or a quote-unquote study, which will take weeks, if not months, before you get an official study. Is that a fair statement?
So promising but not conclusive, it sounds like.
On which?
On that type of treatment in hospitals.
Yeah, there has been anecdotal evidence that it is promising. That's why we're going ahead. Doctors have to prescribe it. There are some people who have pre-existing conditions where it doesn't work, or they're taking medication that's not consistent with this treatment. But anecdotally, it's been positive. We'll have a full test once they have a large enough sample and data set, Jesse. But anecdotally, it's been positive. And if we get an additional supply, we can, which the federal government says they're going to send, I'm going to mention it to the president, actually, when I call him this afternoon with the comfort. I'm going to make a note right now. If they increase the supply, we can lift the 14-day limit ban.
Governor, earlier today, there's the notion that the city would maybe be burying these COVID bodies in parks in New York City. Wondering, one, have you heard of that? And two, is there any way the state can lend assistance with managing these bodies? And what do you think about that?
I have heard nothing about that. I've heard a lot of wild rumors, but I have not heard anything about the city burying people in parks.
Would you support that?
No.
What plan do you have to manage these bodies? I know there was.
I didn't know that there was an issue. I haven't heard that there was an issue. Has anybody heard that there's an issue? Does the city raise any issue? They talked to New York City. I talked to New York City yesterday. I have not heard that this is an issue.
Mayor Bill this morning requested that the state release more ventilators from its stockpile to the city. To date, how many ventilators have come from the state stockpile to the city, and have they asked for any more at this point?
They have not asked for any that they have not gotten. We're releasing 802. The city is basically responsible for the 11 Health and Hospital Corporation hospitals, public hospitals. There are 11 health and hospital corporations. 11 health and hospitals in that system. And I spoke to the head of the system last night. I'm going to he's going to be on a phone call at 1 o'clock. Dr. Mitch Katz, he had all the equipment he needed, and I'm going to speak to him again at 1 o'clock. So if they need anything, we'll get it to them.
802 combined? Like, that's how many?
802 for the downstate area. Now, every hospital will say to you, I am running low on everything, because they are low on everything, right? When we do these daily surgeon flex discussions, there's no margin for error, because we don't have any margin for error. We just don't have the supplies. The whole system is over capacity. So everybody is low on everything. And if they had a wish list, everybody would want, stockpile and a reserve in their own hospital. I get that. We don't have that luxury. I'm taking ventilators from one hospital on a daily basis, bringing them to another, and then shifting them back and forth so every hospital can get through this period. That's why I say it's unsustainable for us. So we're doing that with PPE equipment, we're doing that with ventilators, we're doing that with patients. If we can systematically get patients out of the hospital system into Javits and the comfort, then you can relieve pressure on the whole system. But the system is running at red line, has been for days. This is the most intense management function that we have ever undertaken. So it's not here, in this situation, it's not what they want, it's what they need. That's what I said. Everybody would I want to have 100 ventilators on reserve. I know. It's what you need. And that we're doing on a day-to-day basis. But everyone has what they need. There is no one who said, I'm out of ventilators and I have a critical need who hasn't gotten them.
You're calling for.
Go ahead.
You're calling for increases in crackdowns on social distancing, but we're getting reports of funerals and weddings in Orthodox Jewish communities in Rockland County and in Brooklyn still being attended by hundreds of people. Then
they should enforce the rule, Jesse. I don't care if you're Orthodox Jewish, Catholic, Christian, Muslim. I don't care what. It's not about religious observation.
But is there anything you can do, state police or other resources, to try to break these?
The state police will enforce it also, but let a local government. It's a job of local government to enforce. I'm doubling the fine. It's my way of saying this is serious. This is serious. What right do you have to act irresponsibly in a way that could get you sick or someone else sick, and then I have to send an ambulance to pick you up and bring you to an emergency room that's already overburdened, that doesn't have staff, doesn't have supplies, doesn't have ventilators, because you were reckless and irresponsible. You don't have that right. And I have to talk to these healthcare workers all day long. I talk to transit workers. I talk to first responders who, truthfully, nobody wants to put themselves in these situations, and I don't blame them. And they're doing it out of passion and commitment and public service. None of us has the right to be reckless in our own behavior which compounds the problem we're dealing with. Now is not the time to be playing Frisbee with your friends in the park. It's just not. Now is not the time to go to a funeral with 200 people. Look, I'm living this with my own family. Yes, I understand grieving, and I understand how the religious services can help with the grieving process. And I understand how it's hard not to do that. But as a society, the risk is too great. Enforce the law. The localities have the legal right and responsibility to enforce the law. My doing the penalty, raising the penalty, is my way of saying, do it. Just do your job.
What percentage of available ventilators in New York are being used today?
Oh, all of them.
They're,
We're beyond capacity.
what about the stockpile? Like how much remains in the state's stockpile?
We're beyond capacity. We are into the Plan B, C, D that we outlined, right? We are into using BiPAP machines instead of ventilators. We're into splitting ventilators, turning 2 into 1 with 2 sets of tubes. We are into all backup plans that we had.
So how many ventilators are still in the state stockpile, though, at this point?
The stockpile, I don't know. I can get you the number, but we are over capacity for the number of ventilators in the whole system. We're using BiPAP machines, we're using splitting, et cetera.
I guess that begs the question, though, why not? If there are still ventilators in the state stockpile, why don't you send them to New York, to the city?
No, we don't have anyone who says they need them now who doesn't have them.
But you just said they're over capacity.
Well, they're using the Plan B, C, D. We can't give everybody a ventilator for every situation. We have 9,000 BiPAP machines, for example. We're using the BiPAP machines, we're using the other machines. But we don't have anyone who says the 802 that we're sending today represents the number that people say they need now. Let me say that.
Elections, 10 people have gotten sick and 3 people have passed away. Do you think they should continue working processing petitions or challenging petitions?
We extended the deadline, the voting and filing deadline. So I don't know what else legally that we could do than extend the deadline. You'd have to cancel elections, period, for the year. And I don't think we're in that position. We've extended the use of absentee ballots.
Governor, are portions of nursing homes being set aside to treat COVID patients?
Are portions of nursing homes being set aside to treat COVID patients?
We're working with the nursing homes and trying to cohort patients within the nursing homes. Remember, this is something which we've identified in multiple nursing homes across the state.
So does that mean you'll be moving COVID patients to facilities that are otherwise COVID-free?
No, within those nursing homes, we're working to make sure that we minimize the spread of the COVID disease within that place, that facility.
And Governor, regarding unemployment, I'm sorry.
In other words, what Dr. Zucker is saying is when you have a COVID patient who has been in that facility, they're trying to isolate the COVID patients on one side of the facility. We're not using a nursing home to treat COVID people. We're not bringing a COVID person into a nursing home.
Regarding unemployment, is there any break in that log jam? And we're hearing that people who are on the hook to pay child support or spousal support who are out of work are having difficulty coming up with the money. Can the state help them out in any way?
The Labor Department website, the unemployment website, do you know anything about that?
Yeah, so we've now partnered with Google. We're going to be releasing a new interface by the middle of this week. They've moved from 5-day-a-week hotline to 6-day-a-week headline. They're now 7-day-a-week headline. They've expanded the hours. We've gone from 4 servers to 50 servers. They're trying to do the queue by last name so that if you're between A and D, you call on Monday, and separating them out to try to manage some of the volume. But just so everyone understands, at the peak of the 2008 crisis, in the single largest day of claims was 13,000 in one day. We had 6 times that 2 days ago. So this volume is something that we've never experienced before, and it's frustrating and it's horrible and it's unacceptable, but we just ask that people remain patient, and we are working at it. We just put 300 more people in addition to the 700 people that were manning the call system. So we are trying to do everything we can to attack this issue. And most importantly, you will get your benefits going back to the date of your actual unemployment, even if there's a lag in being able to get signed up for the benefits.
The Florida regions this morning announced they were canceling the regions that were going to be held in June. Do you agree with that decision, or are they planning?
I haven't even looked at their decision on the regions.
Governor,
It sounds right, but I haven't even looked at it.
the de Blasio administration canceled the pilot program to open streets for New Yorkers in order to encourage social distancing, et cetera. But they announced they're shutting that down because there weren't enough New Yorkers to justify that. What do you think about that? Was that a failure of that attempt? And also, you just increased penalties, so what's going on here?
I don't know. You know, New York City localities make decisions on their own on local issues. So I have no reason. I don't have any opinion on what the mayor did. I just don't know the facts well enough on that program. The social distancing, we have again hopeful news in the data that it could be slowing, plateauing, turning, but it's also dependent upon what we do and how we handle ourselves. And we know that social distancing is important. That's why I'm extending the ban on keeping businesses closed, extending the ban on schools. But people, it's individual behavior that has been problematic over the weekend. I get that it was a nice day and the weather was good and people have been cooped up. I get it. I get it all. I'm living it just like everybody is living it. But we get reckless, we change, or we're not compliant on social distancing, you will see those numbers go up again. That's why I showed you the Hong Kong, the China experience. They let their foot off the gas too quickly. And we have been behind on this virus from day one. And this virus has kicked our rear end. And we underestimate this virus at our own peril. We learned that lesson. Now is not the time to slack off on what we're doing. One more question. We are moving ventilators now among the system. When someone has a change in patient load and they have additional ventilators, we move ventilators. But we have moved thousands and thousands of ventilators throughout the system. We've acquired thousands and thousands of ventilators. I also want to thank Oregon for sending ventilators. I want to thank the state of Washington for releasing ventilators and suggest that they be sent here. I want to thank California that also this morning released ventilators because they thought that they could be helpful to New York. That is the right attitude. That's the only way we do this as a nation. We're going to have to be flexible and handle the surge as it moves across the country. That's just what we're doing here in this state. Surges in Nassau one night. We move assets to Nassau. Surges in Rockland. We move assets to Rockland. So that's the only way we're going to do it because the federal stockpile. If the federal stockpile has 9,000 ventilators or 10,000 ventilators, that's not going to do, it's not going to be enough for a nation, right? So you're going to have to get states cooperating and shifting and moving within the country. New York will be first on that list. As soon as we get through this and we have any flexibility in our system, we will be there for every other state like they have been there for us. And we will lead the charge the way we always have. Hurricane Katrina, we were the first ones down there, right? So when anyone needs anything, we're there. Right now, healthcare wide, I'm going to get on the phone with the hospitals now. There is no hospital that needs ventilators that doesn't have ventilators. There's no hospital that needs PPE that doesn't have it within the state system. Again, they're all going to say they're running low because they are, but nobody doesn't have what they need to do their job. And that's my point on perspective. Are we managing this situation the best it can be managed? Yes. Have we lost anyone who we could have saved? I don't believe so. And with that, we can sleep at night. I have to go to work. Thank you, guys. We don't need any additional ventilators right now. And we have, California has released ventilators. State of Washington has released ventilators. We got 1,000 ventilators from China. So right now, we're okay. I'll see you tomorrow.
you.